Alright, this is our pre-lab video for the skull. There is no dissection video for this lab since there is no dissection. So this is the only video you'll need to watch to prep for this lab. When you get to lab, it would be great if you could move to the back part of the lab where the empty tables are. Your group should find a space to work on one of the empty tables and grab one of the real skulls and one of the synthetic skulls because you'll want to have both to be able to work through this lab and see the structures from both points of view. So once you get started, get oriented, grab yourself an atlas, make sure you have some sort of reference material to work from. Either Grants or Netters works great for this. And then go ahead and get started by going through the Lab Objectives Manual. You'll see this one's pretty descriptive. It has some descriptive text in it, as well as a long list of structures. Don't be overwhelmed by the length of the list. As you work your way through, I think you'll find that a lot of these are just subdivisions of structures within bones, and many of them are intuitive. There's only some that will require any additional explanation beyond just their names. So we're going to start the skull lab by working through the facial bones. These are pretty straightforward. One of the things you'll find as you do the bones of the skull is that every bone has lots of little parts on it, and I think it would be smart to sort of, as you're working your way through each view, to try and to identify the limits of each bone that you see. So frontal bone, for example, ends here at the nasion, but then works its way underneath and forms the roof of the orbit. So that one actually has quite a long extension and then works its way posteriorly. Some of the pictures, especially in Netters, are colored, so you can get some sort of colored differentiation of those boundaries, like sort of like this, where you can really easily see the edges. That would be a good thing to do as you're working your way through these. So there's frontal bone, zygomatic bone, as we talked about, forming part of the lateral wall of the orbit. Also some of the zygomatic arch, the maxilla, the nasal bones, and the mandible. As you can see from all these little blue pins that show up everywhere, there's lots of parts of each of these bones, and as dentists, it is your responsibility to know the items that are on the list. So make sure as you go through to be thorough and take care of those. Okay, so let's move on to a lateral view. And again, the bones themselves aren't hard to find. They're big bones, but emphasize where the bones end one from another. Identify the landmarks that are indicated on the list for that section, and that should do us. Note bones like the sphenoid or the temporal bone that you can see from lots of different views. Those are the bones you'll have the most trouble with. Okay, so let's turn that off there and move on. To a superior view, where we're going to see the different bones of the calvarium. And these will obviously include frontal, parietal, paired, and occipital in the back. Identify the sutures between these bones, and you should be able to easily see where they sort of fix together in this zigzag line in all these different places. And then you'll also want to identify the points of sutural convergence, where the sagittal suture meets the coronal suture to form bregma, and the lambdoid suture meets the sagittal suture to form lambda. And these are helpful surgical landmarks for relationships on the skull. Then we're going to want to go into the skull, and I would suggest working your way anterior to posterior on this one. It sort of breaks it up into more manageable chunks. The frontal bone, ethmoid bone, and then the sphenoid bone also forms part of the anterior cranial fossa. You see there's a zillion pins on the sphenoid bone. There's lots of little parts. We're going to have you figure out all the different components of this sella turcica, remember the saddle, and be an expert in the sphenoid by the end of the day. Moving on to the middle cranial fossa. This is really just sphenoid and temporal bone. There's a fair amount of anatomy here. We get into all the sort of key foramen of the V1, V2, and V3. You'll find those in this area. Get this unblue here. And then with the posterior cranial fossa, we're really just talking about the back half of the temporal bone and the occipital bone. So that's not a whole lot of story going on there, but that's where you're going to see jugular, foramen, internal acoustic meatus, hypoglossal canal. Okay, so from an inferior view, let me turn that off. We've got a lot of the same bones we've seen before: occipital bone, temporal bone, lots of like little bitty anatomy in here, lots of small foramina, little structures here and there. If we turn some pins on some of this stuff, there's quite a few little structures in this area that you need to identify. Temporal bone has this part of the zygomatic arch, and then the zygomatic has the other. So you should be able to see where you can separate the zygomatic arch into those two parts. And then if you sort of turn towards the oral region, there's obviously the maxillary component of the palate, and then the palatine bone part of the palate. And then take a minute to sort of turn this thing around a little bit to try and identify that the palatine bone also has this vertical component that it forms part of the lateral nasal wall. So it is actually a bone. It's shaped like an L, and then the two L's come together. Here's the other one, to form essentially like a U when you put all of those sides together. Sphenoid is also visible from below. It has a lot of parts in this area, including the medial and lateral pterygoid plates. So have a look at that, see if you can figure out all the parts of the sphenoid in this area. And then if you look closely at the nasal cavity, there's a small bone that forms part of the nasal septum. That's the vomer. And then you may also be able to see some of the nasal conchas from within the nasal cavity as you work your way in there. Okay, so next we'll want to turn to the mandible, identify the structures of the mandible. There's lots of parts of the mandible, as you can see, but for today, for watching your video, just make sure you're already familiar with the structures like ramus and angle and body before you walk into the lab. That's a good starting point. And then the end of the lab, we'll turn to the orbit and just focus on making sure we can identify all the different bones that constitute the different walls and structures and surfaces of the orbit. And these are laid out in the objectives manual, but you'll see maxilla forms the floor. The medial wall is mostly ethmoid with a little bit of lacrimal, a little bit of maxilla. The roof is mostly frontal bone, and the lateral wall is a combo of sphenoid and zygomatic. So just reinforcing what we've already discussed in lecture. So there's lots of landmarks, lots of foramina. Today's the day to figure them all out. Also remember that you have the exploded skulls as resources. We'll see what happens when we explode this skull, if it all just goes to pieces. Oops, where'd it go? Come on back now. We better bring that back together and go home. There we go. Sort of all went to pieces there. But what we can see is if we look at the exploded skull, I'll just do this by hand. You can take this all apart, and probably the most useful thing for you to find on the exploded skull is going to be the sphenoid and the ethmoid, because these are pretty hard to see where they fit in the skull. Okay, I'm just pulling these over one at a time. And then that's going to give us the ethmoid bones. Here, let's get these conchas out of here. The ethmoid, that's sort of like a little box that's right in between the orbits. Here's the orbital surface on this side. Get rid of these lacrimals. And the orbital surface on this side. So it's just sort of like a little box. Forms part of the nasal septum, forms some of the conchas. So see if you can sort of try and visualize the ethmoid from multiple viewpoints. And then if we get rid of the ethmoid, then we can see the sphenoid, that sort of unusual butterfly type shape that the sphenoid has. And these two has these sort of descending pterygoid processes on each side. So make sure you spend time on that sort of activity, making sure you can identify the individual bones too. It's not a goal of this course that you should be able to pick through the rubble of broken skull bones and identify each individual process individually, but I think it's totally fair that you'd be able to identify an isolated bone from the skull and be able to say that, hey, this looks like a zygomatic bone because it has this frontal process, this maxillary process, and this temporal process, and it has this curve that makes me think orbit. So that's sort of what we're shooting for, is that ability to identify these bones on their own. So that pretty much covers the what we're going to do in the skull lab. Look forward to seeing you in class.